Hi, I'm Dr. Seung-Hak Baek in Seoul National University. I would like to explain my article about artificial intelligence-assisted landmark identification. Most AI studies have trained and tested their models using initial lateral cephalograms only. The accuracy of landmark identification by AI can be affected by presence of a bracket and surgical plate and screws, fixed retainers, and bone remodeling changes in pre-surgical, post-surgical, and debonding lateral cephalograms. Therefore, the purpose of this study was to investigate the pattern of accuracy change in AI landmark identification in serial lateral cephalograms of orthodontic surgery patients. Inclusion criteria was the skeletal class 3 patients who had undergone pre- and post-surgical orthodontic treatment and two-jaw surgery, and whose serial lateral cephalograms were available. The data set was obtained from 10 university hospitals. 751 skeletal class 3 patients and 3,004 lateral cephalograms were used for training and validation set. And 46 skeletal class 3 patients and 184 lateral cephalograms taken at 4 time points was used test set. And they were subdivided into genioplasty and non-genioplasty groups to investigate the effect of genioplasty on the lateral landmark located adjacent to the genioplasty area. 12 skeletal and 8 dental landmark was digitized by a single orthodontist who had 20 years experience and the CNN algorithm model. In the present study, Cascade CNN algorithm was used for efficient detection of ROI and the landmark. Absolute distance between human gold standard and the CNN model was measured, and error value less than 1.5 millimeter was considered as accurate. And then accuracy percentage was calculated using formula. In this study, the total mean error value was 1.17 millimeters, and 74.2% of accuracy percentage were obtained, which indicate accurate and a high degree of accuracy. As you can see, there was no significant difference in the mean error values among 4 time points. However, ANS and the maxillary and the mandibular first molar distal point showed some difference between 4 time points. Therefore, it was necessary to compare the mean error values before and after surgery using 2 time points. There was 3 patterns of accuracy changes between 2 time points. First, PNS, Pogonian, Menton, articulate did not show significant difference between 2 time points. Second, ANS, A point, B point showed increase in error values after surgery due to surgery and proximity to surgical plates and screws. Third, maxillary and the mandibular first molar distal point showed some decrease in error values after surgery due to correction of the sagittal and vertical discrepancies. However, the delta value was clinically insignificant. As you can see, their order value was less than 0.5 millimeters. When compared the mean error value between genioplasty and non-genioplasty groups, there was no difference in the mean error values, B point, Pogonian, Menton, mandibular central incisor, crown, and root. Therefore, The Cascade CNN model used in this study showed a possibility of accurate landmark identification in pre-surgical and post-surgical and debonding lateral cephalograms despite presence of brackets, surgical plates and screw, fixed retainers, and genioplasty, shape modification of the bone, and bone remodeling changes in diverse quality of lateral cephalograms obtained from 10 institutions. This article can be found in the KJO homepage, and thank you for your kind attention.